Hello Canada, my name is Simon New and this is the Uncommon Loon. It's been over 2 months since Quebec declared a state of public emergency and Montreal's become the epicenter of the COVID crisis in Canada. Quebec is now the 7th deadliest region in the world for daily coronavirus cases. I only say this because Canada is so preoccupied with its global standing that, we're actually kind of proud. The province has over 48,000 COVID-19 cases. That means that Quebec has more coronavirus cases than the rest of Canada's provinces and territories combined. Montreal alone has more than 24,000 of those cases and over 2,500 COVID-related deaths. But Quebec started its fight against the pandemic strong. Premier François Legault made the province one of the first to enforce a lockdown for everyone but essential workers. And at the beginning, Quebec was testing almost more than any other province. So what went wrong? How did things go so wrong in Quebec and especially in Montreal? Your instinct might be to blame it on the double kiss, or an errant juggling unicycling mime, or the fact that it's physically impossible for the everyday Quebecer to resist a fancy wine and cheese picnic in the park on a sunny Wednesday afternoon. The real answer might be a little more nuanced. Was it because Canadians were encouraged not to wear masks, especially homemade ones, by the Chief Public Health Officer until April? Or was it because of the 5G cell phone towers in the greater Montreal area, some of which have been set on fire in recent days? There are a few key factors that answer this complicated question. First, we'll look at the high death rates among the elderly living in long-term care centers in Montreal, which are often referred to by their French acronyms CHSLDs, or CHSLD. So these CHSLD residences have been hit hard, really hard. They've experienced more deaths than hospitals or individual homes as the virus is especially dangerous for the elderly. It's also because a lot of these CHSLDs are in older buildings with tight living spaces. So while the elderly as a group have been socially distanced from the rest of society, residents in homes are packed in too tight to keep separate, and the virus is able to spread quickly. I mean, these places are packed more densely than a Doug Ford cheesecake with a graham cracker and austerity base. There have also been complaints that staff weren't given enough personal protective equipment. It's unclear exactly how many seniors have passed. It seems that Quebec Health Department's numbers don't align with what the CHSLDs are actually reporting. For example, at the Huron residence in Dorval, where caregivers initially abandoned the CHSLD in March because of poor working conditions and a lack of protective equipment, we know that at least 46 people died there by the beginning of May, but the Quebec Health Department only puts that number at 23. Now, I'm not sure how they came up with less than half of what that residence actually reported, but something's not right there. We do know that at least 2,500 of Quebec's 4,000 deaths have come from seniors' residences, and that number is probably higher. At least 22 CHSLDs in Montreal are in a critical situation, with more than a quarter of their residents testing positive for COVID-19. And the government even called in the military to help the CHSLDs after appalling conditions were found at the Huron residence, including abandoned bodies and seniors left unfed in soiled diapers for days. What the f***? There are also just not enough trained patient attendants to staff these long-term care residences. They were understaffed before COVID hit, but now many of these caregivers are off work because they've been infected with the virus, which has left the CHSLDs in a desperate situation. In mid-April, Premier Legault asked that retired healthcare workers and teachers with healthcare experience volunteer to work in the CHSLDs. That's like a gritty cop movie about an old detective coming out of retirement for one last job, except instead of finally catching the one who got away, he spends his last 3 weeks hooked up to a ventilator because of the department's incredible lack of foresight. Understaffing, cramped living spaces for too many seniors, and a lack of protective gear created a perfect shitstorm for these long-term residences to explode with the COVID-19 virus. The second factor that we'll look at is which communities in Montreal have been hit the hardest. They're mostly lower income neighborhoods with higher population densities like Montreal North and Mercier, Hochelaga, Maisonneuve. But you may say Toronto and Vancouver have similar population density and Toronto has a larger population. Well, that's true, but Toronto and Vancouver are way more expensive to live in than Montreal, like way more. The average monthly rent for a one-bedroom apartment in Vancouver is about $2,200 a month, and that same apartment in Toronto would be $100 more. But a one-bedroom in Montreal, almost $1,000 cheaper. That means you can live with 1 to 2 quasi-employed aspiring artists in their mid-30s instead of the standard 3 to 4. Think of what you can do with that space. That means that Montreal is a lot more accessible for people who can't afford astronomical rents, who are able to afford to live in the city's core. And many of these people who work in essential services were never laid off or able to work from home, like warehouse workers, delivery workers, food processors, people we rely on to keep our supply chain moving so we can put food on the table. And as we've learned recently, low-wage workers like cashiers, nursing home attendants, that person that brings you your precious banh mi to your door, they're also essential, and they haven't been able to work from home either. Most of these jobs have very limited paid sick leave, which means that workers are less likely to take time off when they're feeling sick because they still have to put food on the table. And often they're only earning minimum wage. The common refrain for minimum wage jobs is that they're cheap because anyone can do them. But it turns out that we aren't looking to Bryce, junior marketing analyst at Woofle, it's like Google for dogs, to keep the very fabric of society together during this pandemic. Maybe it's time to rethink that. So these essential workers are working in precarious situations, some with the public and some in residences, and at the end of the day they go back to their apartments with their families and roommates, and they inevitably pass on what they've picked up. And according to a study by the Canadian Centre of Policy Alternatives, a very high percentage of these workers are racialized workers. Montreal North, one of the poorest neighborhoods in Canada, has over 2,200 COVID-19 cases, the highest per capita in Montreal, and over 160 deaths. Many Montreal North residents work in CHSLDs and have brought the virus back home with them, and their loved ones have died because of it. Besides seniors, these are the people that have been hit hardest by the virus, and they're likely not aware of the resources that are available to them. Reason number 3, spring break. So this one's a little out of left field, but yes, one theory is that spring break and the weeks leading up to it were critical in bringing COVID-19 back to Montreal. First of all, Quebec's spring break is earlier than other provinces. Students were off this year in Quebec for 9 days from Saturday, February 29th to Sunday, March 8th. A recent report by Radio-Canada detailed how many Quebecois traveled between provinces abroad in February leading up to spring break by using geolocalized data from cell phones. That's right, your data isn't just for selling to advertisers anymore. Now it can keep tabs on your whereabouts and somehow convince Wish.com that you need a bulk order of Garfield masks and clear plastic stilettos. Speaking of face masks, the federal government is now advising everyone to wear face coverings in public. This resonates awkwardly in Quebec due to its recent legislation banning face coverings and religious symbols for certain professions and government institutions. Everyone has their own version of this joke. Mine is, hey Quebec, why you gotta be racist and covered in murder germs? So anyway, the report shows that over 600,000 people traveled throughout Quebec during spring break, most of them coming in and out of Montreal. That week, thousands of Quebecois flew to Europe or drove down to the States, including Florida.
At the end of the day, I'm not gonna let it stop me from partying. I've been waiting.
It wasn't until March 13th that the Quebec government closed schools and advised against non-essential travel. The Radio-Canada report shows that about 2 weeks after spring break, around the time that it takes for COVID-19 to produce symptoms, the Montreal rate of COVID skyrocketed. Because kids got off school earlier than other areas of Canada, families were able to bring the virus back home in astonishing numbers, and then were able to go back to work and school for a few days before the province entered lockdown. Language politics. How could we have a show about Quebec without discussing language politics? Earlier this month, when they asked why a recent survey showed that Anglophones were more concerned about contracting the virus than Francophones, Premier François Legault pointed to English media being the problem. He singled out the Montreal Gazette's health reporter Aaron Durfell and said,
I think the journalists, you have a responsibility. I like to read certain journalists of the Gazette, the specialist in health. Sometimes I really disagree with him.
You'd think that numbers would be the one thing that wouldn't get lost in translation. But we can't blame Mr. Durfell for reporting the facts like death tolls and infection rates as a health reporter during a pandemic. He's just doing his job. The report, carried out by the Quebec Community Groups Network, showed that Anglophones were much more afraid of their family members getting the virus than Francophones. It also showed that Anglophones were in favor of slowing down the pace at which social distancing measures are being lifted more than Francophones, and that Anglophones were 21% more likely to wear a mask in public. Now, who can say why English speakers are more afraid of getting sick and dying than French speakers? It could be that English neighborhoods like NDG and Côte-Saint-Luc were some of the first areas hit with significant outbreaks in Montreal. Or it could be that most of Quebec's English-speaking population lives in Montreal, the epicenter of the COVID-19 pandemic. Or maybe it's because they're all just a bunch of sissies. Point number 4. Quebec government and what's to come. Quebec, like all other provinces, is attempting to strike a balance between protecting its citizens' health and caring for its economy and way of life. But it's also the most aggressive province about reopening. It's been close to a month since Premier François Legault said he'd lift restrictions on schools, daycares, and non-essential businesses. At first, the Premier said that Quebec would gradually lift lockdown restrictions, including schools and daycares in Montreal, on May 4th. But then he backtracked after being accused by parents of using their children as guinea pigs. Then the Premier said that daycares and non-essential businesses would open up on May 11th, then delayed it a week to May 18th. It's as if the Premier is driving a province full of children asking, are we there yet? Perhaps in the coming days, Legault should keep telling his public, 5 more minutes. And finally, Montreal retail stores with outdoor entrances opened again on May 25th. And dental clinics, pet grooming, and therapeutic centers will be allowed to reopen in Montreal and the rest of Quebec on June 1st. And as of the last week, groups of 10 people from 3 different households are allowed to congregate in Montreal as long as they maintain social distancing measures. Unsurprisingly, Montreal's parks were overcrowded last weekend. So why is Quebec pushing to reopen the province faster than the rest of Canada? The WHO has warned that coronavirus cases have drastically increased in countries that cease lockdowns, like China, Germany, and South Korea. And the problem's not only in Montreal, the virus has also skyrocketed in towns all over Quebec who are experiencing dire situations. Berlettano, located an hour and a half north of Montreal, has over 3,400 cases, and the Montérégie region south of Montreal has 5,400 cases and growing. That's more than most provinces in Canada. Experts have also warned that we haven't yet reached a herd immunity, which is when a significant chunk of the population has either gotten the virus or been vaccinated for it and developed antibodies against it. Only then can we begin to live our lives normally, and it looks like we'll have to wait for a vaccine to completely go back to normal, whatever that looks like. We haven't flattened the curve yet, we've just slowed it down by maintaining social distancing measures and staying away from each other. The Quebec Public Health Institute's website says that new COVID-19 cases in Montreal could rise to 10,000 a day in June, and deaths in Montreal could rise to 150 a day in July if physical distancing measures are lifted completely. And remember that worldwide pandemic in 1918 when the Spanish flu killed an estimated 50 million people, most of those deaths occurring during the second wave of the pandemic? Yeah, let's not do that again. I know we're desperate to get people back to work, to get the economy rolling again, but maybe, just maybe, instead of jumping the gun and rushing to reopen the city and the rest of the province, which would undoubtedly cause more people to lose their lives, it might be better to wait before we start lifting lockdown measures. If the situation's spiraling out of control despite measures in place, what makes you think that eliminating the existing precautions would do anything but escalate the danger to the point where even francophones are worried? Let's wait until the situation is under control, or maybe even wait for scientists and healthcare professionals, the people who know best, say it's safe for the general population to go back to work. That's our take of the Uncommon Loon. Thanks for sticking with us this long. We'd like to take an opportunity to tell you a little bit more about this project. We're a group of Canadian journalists, comedians, and actors who are dedicated to investigative news and comedy. We want to make a show that digs deep into Canadian issues, exposes the truth, but also makes it palpable, funny, and entertaining to our audiences. This is a work in progress, so any support is appreciated. Check out our Patreon, subscribe to this channel, click that like button, and check out our social media. Dude, they set the 5G towers on fire. They thought that their text messages were going to give them a viral infection. Stupid. Ridiculous. Being